Is that the murmur that I had over the years?
Maybe. I didn't know what you had before, but it probably would have been that one. Now, it's getting to a point where we have to talk about something like open heart surgery for it. Now, that's a big question for you guys to consider because this is not a surgery to be taken lightly.
Sure.
Okay, this is something where the surgeon would check out your valve, make sure the rest of it is okay, and then we would look at your coronary arteries and stuff like that to make sure those are okay too, because if they're gonna open you up, they might as well do everything that they need so they wouldn't have to go back again.
So what valve is it?
The aortic valve.
Okay.
Yeah, and it's severely regurgitant, meaning that it looks like one of the cusps, it's not well visualized on the ultrasound, but one of it just doesn't close correctly.
Mm-hmm.
So it looks like there's just a lot of backflow that goes backwards right into the heart.
Mm-hmm.
The
Instead of
squeezing,
going one way, yeah.
correct.
Mm-hmm.
So it should be a one-way valve,
Mm-hmm.
and now it's like it goes and then it
Swish
comes
and
back.
comes in, yeah.
So then over time, this can cause his symptoms. It usually doesn't present the way that he came in, but it can present that way. So then the problem is, do we want to fix it or not? Yeah.
Mm-hmm.
Are you recording by any chance?
Yeah, actually, is that okay?
You have to ask our permission
Oh.
before we do
Yeah,
that,
go.
but, yeah.
Is it okay if I record?
Sure.
It's really for my siblings.
Yeah, yeah. So the valve is regurgitant, and I guess we need to discuss whether you would want to pursue.
What are the pros and what are the cons?
Well, the cons are that it can get progressively worse, and then it may be to a point where he keeps on blacking out, and if God forbid something else happens, okay, like he can pass
So
away.
instead of the blood flushing out completely, it partially goes out and comes right back in, is what you're
Correct.
saying.
Correct.
So you're not getting full functionality of the heart, each pump of the
Yeah.
heart.
So his pumping function is actually normal. So his forward flow is good. It's just quite a bit of it comes back. And then we pretty much have to talk about it and see.
Would you be doing the surgery?
I'm a cardiologist, so I'm not the cardiothoracic surgeon. But we would have the cardiothoracic surgeon come talk to him
Mm-hmm.
after we do some evaluation.
Okay. So when you say a significant of it comes back, how much efficiency are you getting? Is it 50%? Like,
So we didn't perfectly grade it on the transthoracic echo, but I would say maybe 30 to 40.
so,
Like that.
oh, I see. Okay. And that could have caused the issues with passing out, just poor blood flow to his brain.
Yeah, so he does also have a couple other issues. I can't say with 100% certainty that is the cause. His hemoglobin, his blood level is also very low.
Mm-hmm.
It's in the sevens. Usual for a man is 13 to 14,
Mm-hmm.
even if you account for the older age.
Okay.
Does that mean he has some type of bleeding somewhere?
They
Wow.
checked him out. That I have to leave to the GI doctor to discuss.
Okay.
But
Would he have like black stools? If it's
yeah, so usually when you have black stools, you have an upper GI bleed. That's why Dr. Lai took him yesterday to
Right.
look, and he said he just has some inflammation there, but nothing that would overtly cause that. So we're working him up here. The other physicians are consulting, like the GI doctors, they may consult the hematologist and make sure we don't have another explanation for why your blood levels are low. But this can be why you've been passing out every now and then over the past 2-3 years, is what you told me.
Right.
Yeah.
Well, it happened about a year and a half ago. And same symptoms, well, very similar symptoms as a year and a half ago. And then it happened again prior to that too.
So there are a couple of things that we're checking out right now. We pulled blood cultures for you yesterday. If you have an infection of the valve, it can cause this. I feel like that's lower on the differential for me because you didn't really have fevers. It's not like you're having cold sweats that night or anything like that. But we're gonna do that to make sure. And then if you're still here by Tuesday, I'm gonna consider whether we wanna do a transesophageal echocardiogram or not. I talked to my interventionalist, so I'm an electrophysiologist. I'm just rounding over the weekend. I'm the electrical guy, but you will need to be followed by a general cardiologist, and I may send you to the interventionalist to see if we want to look at your coronary arteries too, if we decide to proceed with surgery.
Okay.
The problem of health insurance, I'm a Kaiser.
Okay.
I'm in the Kaiser. I don't know what the procedure is when you have one outside doing it or having Kaiser doing it. So
Yeah.
that has to be worked out between the two.
Yeah. So
Two parties.
you're more than welcome to follow up with the Kaiser person too.
Yeah.
So it's. I
But-
mean, I'm slightly emotionally attached to you now, but it is. Just as long as you follow with someone very closely, I'm okay with it.
Yeah. I mean,
Well,
well,
that-
since you're here, you might as well get all the tests done that you can.
Well, yeah, that's what I intend to do, I guess. I guess that Kaiser has to authorize all the tests that they're following through.
Yeah.
I know I've had this murmur, I guess is that the flap doesn't close, correct? That's for many years.
Yeah. Assuming that murmur that they heard before was caused by this.
Oh,
So
I see.
if they did not do an ultrasound at that time, we don't know for sure.
So,
Okay.
Has anyone done an echo on you before?
I've had so many tests,
Yeah.
I believe, yeah, I've had.
Usually they do.
I have, yes, I have done echocardiogram.
Yeah.
I do that almost every year.
And they never told you it was severe or getting worse or anything over
No.
the course of the past few years?
No.
Okay. S- Oh,
But,
so
my internist orders that like every
I see.
year.
Al, what's your internist's name?
Uh,
We'll try to get records on it tomorrow at least, so
Okay.
I can see on paper whether it's significantly worse
It's,
or not.
with Kaiser, it's Dr. Williams,
Okay.
and.
What's his first name or her first name?
She's out of, East LA, clinic.
Okay.
I can't remember her first name.
Anyways, right now, I've given you guys a lot of information to process,
Mhm.
and I want you guys to talk about it without me here. There's nothing that we're doing today anyways.
Okay.
It's a Sunday and most of the other services are not here.
Okay.
And it gives us some time to think about this.
Sure.
Okay?
But I do have another question. So you had mentioned that it may be caused by an infection.
I think that's low on the
I see.
differential, but
But
we're
you'll
checking
test
it
for
out.
that.
We've already pulled the blood cultures, yes.
I see. Okay.
That
And there was
usually
no-
takes about 48 hours.
I see. But if it is, then it could be treated by like antibiotics or something then, or some
The
systemic.
next step, if it was infectious, would to be doing a transesophageal echocardiogram, where it's like the echo that he got out here,
Mhm.
but we put it down through his throat.
I see.
And then we
Okay.
have to go look at the valve a little bit more.
I see.
Yeah.
And if surgery is called for, then it would be a valve replacement surgery.
Correct.
Then. I see.
And any other issues that they
Yeah.
find.
Yeah. All right.
How
Okay.
successful is a valve replacement?
This you would have to talk to the surgeon
Okay.
about, but the surgeon that I would have see you is very good at what he does. Very, very good. Okay.
And that would be, it has to be probably discussed with the coverage of Kaiser. And,
Yeah, yeah, yeah.
Okay,
All right, buddy.
okay, what's your top two?
Andrew Chen.
Where's your practice at? I'm looking for a new cardiologist.
It's just around here, so it's on.
It's in Monterey Park?
Yeah,
Andrew Chen.
San Gabriel,
San Gabriel.
506 Valley, Sun Valley Engine.